This is Beverly Gale with the Coping with Blindness series on the Beverly Gale channel. And today we're going to do something a little different. We're going to take you down to my doctor's office on a visit with me. For those of you who have been recently diagnosed with macular degeneration, the question is, now what? Well, come and take a look at what is a typical day when I go down to see my doctor, and that might answer some of your questions. So come along. Here we go. What is your name, dear?
My name is Kelsey.
And Kelsey, what do you do?
I'm a certified ophthalmic assistant. We start by taking the patient back. We get your history, find out what you're experiencing, some of your symptoms, why you were sent here. And then we take your vision. We do a vision test, check your eye pressure, and then we'll dilate your eyes so the doctor can be able to examine you better.
Now, does he get that information right away?
He does. We put it all into our electronic medical records, which follows you along to each step of the way you go, and then the doctor has it all in real time.
Well, that's wonderful. Well, thank you, Kelsey, for your time.
You're welcome.
Part of our visit to the doctor, we go into a separate room, and although the regular technician isn't here to explain it to us, Dr. Cohen has been nice enough to stay in his place and talk a tiny bit about this machine and what it does and the purpose of it. Doctor, I give it to you. Thank you.
Thanks. The OCT machine is a common test that we use for people who have macular degeneration. It gives us a picture, a cross-sectional picture of the macula. And one of the things that we look for people who have macular degeneration is whether they are leaking or not. And the OCT gives us a nice picture of the back of the eye, central area called the macula. And that area looks like this when it's normal. And we can compare your picture to what we know is normal to decipher whether you are leaking. We use this as a supplement to our exam to determine if there's a leak. This test is fairly simple. It's non-invasive, and it allows us to just picture the back of the eye. It doesn't require any touching. All you do is sit in the chair, put your chin in the chin rest, and look inside the machine. When you look inside the machine, you'll see a little star when it's this type of machine. And then you look at that while my photographer or the photographer can zoom in on the appropriate area. It's fairly simple, fairly easy, and non-invasive. This is a very, very instrumental piece of equipment. It's called an OCT, ocular coherent tomography, is what we use to help decipher whether you're leaking or not leaking on examination.
And thank you again for allowing me to videotape you.
You're welcome.
To take you into my doctor, Dr. Cohen. And tell me, Dr. Cohen, what is your specialty?
My specialty is vitreoretinal disease. So I take care of patients with macular degeneration, diabetes, retinal detachments, and even patients with eye cancer.
If a patient comes to you and has been recently diagnosed with macular degeneration, what are some of the first things that you want to talk to them about?
Probably the most important part of the initial part of the exam is to figure out and find out and listen to see what they're having trouble with. By talking to them, I can help fine-tune where I think the problem is by just listening. Their complaint will be hopefully specific enough so that I can fine-tune my exam, and when I look in the eye, help find the problem.
And once you find the problem, that would be the protocol or the treatment that you would give to them. So let me ask you this. What types of treatments are currently out there for people who have been diagnosed with AMD?
So patients who come in complaining of AMD usually complain of some central vision loss. And I'll usually hear some of that during the history taking and when I'm speaking to the patient. And then when I look inside the eye, I'm trying to determine if the macular degeneration is of the dry type, and if the macula, which is the back wall of the eye, looks dry but aged, then we give them vitamin supplementation. Vitamin supplementation is not homeopathic or holistic. Vitamin supplementation has been proven to be helpful with scientific studies. So if you're dry, we treat you with vitamin supplements. If there's a more progressive disease, such as wet macular degeneration, then we start to give you injectable therapy with one of the 3 drugs that are available to do so. And injectable therapy are injections into the eye after we've adequately numbed your eye. The process to treat the wet form of macular degeneration when there's leakage has a goal of drying the macula to stabilize and preserve macular function. It doesn't automatically bring back vision, but there are lots of people that we give injections to on a routine basis to just stabilize and prevent progression.
Thank you for that. Do you see any treatments in the future that are going to be different than what you're doing now? Have you seen anything?
I think we will see treatments in the future. Treatments over the course of the years have changed dramatically. We've gone from systemic injections to focal laser treatments that are hot, to laser treatments that are quote-unquote cold, where we're using light and a medicine injected to treat it, and now we're injecting medicines. We've gone through 3 different types of medicines, and they're all a little bit different. But I think there will be stem cells in the future. There will be maybe retinal transplantation or genetic therapy, and there may be even artificial implants. These are all coming in the future. None are here yet scientifically proven, but we're doing research to help promote the way.
As a doctor, and you're going to be all over the country, what would you say, or how would you tell a patient who has just been recently diagnosed what should they look for in a doctor?
Well, everybody has their own type of doctor that they get along with and identify with. Some doctors may be very personable, others may not be. In the end, all retina specialists are well-trained individuals. Everybody has their own way of speaking and dealing with patients, and a lot of them have their own way in treating patients. With macular degeneration, there are many different ways that patients can be followed and treated, and I would be very confident with the doctor that you choose if they're retina trained in taking care of you.
Is there any final comments before I leave today? Perhaps from the standpoint of being proactive with their health. We know that vitamins work, but we have also heard that there are other things they can do, perhaps to stave off and slow it down while they're looking for and or getting treatment.
I think if you have macular degeneration of the dry or wet type, you need to see your physician on a regular basis. In terms of what you can do outside the office for yourself, it is definitely limited when you're talking about proven science. And taking those supplements besides what's proven, which is the arid supplements, are going to be up to you. I recommend exercise, a healthy diet, and the vitamin supplements for the dry and wet form, as well as injections for the wet form. That's what I would propose at this point.
Doctor, thank you so much for taking the time to help with this video today. I'm sure that people who see this will feel a lot more comfortable before they go to their doctor. Thank you again.
Thank you for inviting me to speak.
You're
welcome.
welcome.
It's a pleasure taking care of you.
Thank you. Before we go, I want to mention, it's last but certainly not least, the wonderful staff that makes up those people which are not your doctors and they're not your clinicians, but they are the people that are the very glue that bind together any good doctor's office. They are the people that check you in, find out how you are, check you out, give you appointments, and most importantly, when you need them, calling in and being able to get an appointment when it's very important to you, or if you have messages into your doctor, for the staff to be able to deliver the messages to the doctor and get back to you. Many times we have wonderful doctors, but the staff drops the ball. So it's very important that you have a great staff that works with your doctors. Well, how do you know this? You don't really until you go there. But you can ask the people around you when you've been given a recommendation, how is this doctor? What kind of procedures? How is the staff? Do they get back to you in a timely fashion? If they do, then they're the people that organize and direct and make everything run smoothly. So don't forget about them. They're a very important part of your finding a good doctor. I hope you enjoyed my little journey. It was not totally typical, as you did not see me get my procedures, which is a very private thing, but I wanted you to get a handle on what it is that you need to know what you're going to do once you've been diagnosed with macular degeneration. I am Beverly Gale. This is the Beverly Gale channel. Until next time, bye for now.